welcome back. Did you know that 1 in 5 people worldwide has inherited high lipoprotein A levels, yet most remain unaware of it? Unfortunately, high lipoprotein A, often abbreviated as LPA, is not routinely screened for. Consequently, the initial indication of this condition may manifest as a heart attack or stroke. Joining us now to raise awareness of this important topic are Dr. Amit Khera, Professor and Director of Preventive Cardiology, UT Southwestern Medical Center, and Misty Votaw. Thank you both so much for joining us today.
Thank you.
So to start off, Dr. Khera, can you explain how genetics contribute to the risk of heart diseases and stroke?
Well, thanks for the question. It turns out heart disease remains the #1 cause of death in the United States, and we don't appreciate how much genetics plays a role. So maybe more than half of that risk you're inheriting from your parents. Today, we're talking about a particular type of genetic issue, elevated lipoprotein A. It's a funny type of cholesterol, again, that is inherited, not really related to your diet or exercise. About 1 in 5 people, or 60 million Americans, have an elevated lipoprotein A, and less than 5% of the people are tested for it, this important risk factor for heart disease.
Absolutely. And heart disease remains to be a significant health threat in the United States. So can you tell us, why do you believe it continues to be the single biggest threat in America today?
Yeah, a great question. One is there's many reasons people develop heart disease. The good news is the death rates have come down since the 50s and 60s, but it's still the #1 cause of death. And I think, part of it is our lifestyle factors, our diet, our exercise. But we also are learning more about other causes, like we're talking about today, genetic causes like lipoprotein A. Science is developing, and although we've known about this for 50, 60 years, it's just coming to the forefront about the importance of it and how we can do something about it.
Yeah, absolutely. And Dr. Khera, for those who may not be familiar, what exactly does it mean to have elevated LPA levels, and who should consider getting screened?
A good question. And when you say levels, it's just a blood test, pretty simple test to do. If you have an elevated lipoprotein A, this type of cholesterol increases heart disease risk significantly by promoting clotting of the blood, inflammation, developing plaques and atherosclerosis in your arteries. Many people with lipoprotein A develop heart disease at an earlier age, and so really important to screen for it. Who should get screened? Really, everyone should get screened, but people we're focusing on are those with a strong family history, those that have had a heart attack or stroke, and those with high cholesterol. And if you go to your doctor and they are resistant or reluctant to do it, it is LPA Awareness Month. You could go to the Family Heart Foundation website, and there's some free screening available.
That's amazing. And Misty, could you now share your personal story and how the Family Heart Foundation provided resources or support to you and your family?
Absolutely. So thank you for having me. So my story, like Dr. Khera said, was really one of a strong family history. My dad had a heart attack when he was 40. Later, my sister died at 36 with heart disease. And even after that happened, we still weren't really knowing, what was happening. And then my 48-year-old sister also died of a heart attack. And that's when I decided, I've got to figure out what's going on in our family and try to advocate for us. And I found out that I had elevated Lp(a). And that's when I found the Family Heart Foundation. And really, they just helped connect me to care providers and a whole network of people who are also going through the same type of thing, and really advocate for early screening, which I ended up doing with my family members and finding out that both of my daughters also have elevated Lp(a).
Thank you for sharing that. So Dr. Khera, can you tell us, if someone discovers they have elevated LPA, what proactive steps can they take to reduce their risk of heart disease and stroke?
Yeah, first and foremost, as you heard, it's about screening. So if you have a high LPA, your siblings, parents, children have a 50-50 chance, so they should get screened. And if they do have an elevated level, there's no direct treatments today. Those are coming, hopefully, in the next couple of years. But one can definitely treat their cholesterol, their blood pressure, exercise better, diet. There's so much we can do, but we really need to be pretty aggressive at our risk factors if we have a elevated lipoprotein A.
Absolutely, and thank you for mentioning that at the moment there isn't a direct treatment, but there are certain lifestyle adjustments that you can make to kind of help balance that out. So with that, Misty, what initiatives has the Family Heart Foundation undertaken to address the gaps in care related to elevated LPA awareness and screening?
Yes, I think I'm going to leave that question to Dr. Khera.
Well, I appreciate the handoff, but as she told you, first they're raising awareness and help provide. So first is it's the premier patient advocacy organization. As Misty told you, you can go there and get information to get connected to providers, promoting research, and then really pushing for the screening that we mentioned so that less than 5% of the people that are currently getting tested, that many, many more people get tested.
Yeah, absolutely. And the Family Heart Foundation established Lipoprotein A Awareness Day. Could you tell us more about this initiative and its goals in raising awareness about elevated LPA?
Yeah, boy, what an amazing thing. We know that 1 in 5 people in the population, so 60 million people, have this risk factor for heart disease, yet the vast, vast majority have no idea. There's a big gap there and a real opportunity. So LPA Awareness Day, this Sunday, is really about promoting people knowing more about it. If they need more information, we're talking about it today, but can go to the Family Heart Foundation website, findlpa.org, easy way to find out and get screened.
Absolutely. And Misty, you shared earlier in the interview about your personal story, and either of you can answer this, but can we hear some maybe examples or stories of individuals who appeared healthy but were impacted by early heart disease due to elevated LPA? And let's just talk about how common is this scenario?
Well, I just want to hearken to her story was that story, right? Where really, you had a family of very young people. You're hearing women in their 30s and 40s. That's profound. That really didn't have much of an idea about it. No symptoms before that. And so you've heard that story right here. Now, her story, it's not always that extreme, thankfully, but it certainly is there. And we know that this is an important risk factor. So screening is the first step, that knowledge is power, and knowing whether or not you have an elevated level.
Of course. And research indicates that only a small percentage of Americans have had their LPA levels measured. What do you believe are the main barriers to widespread screening for this condition, and how do we overcome them?
Yeah, we've been thinking about this a lot and have had a lot of discussions. I think one is people are just unaware. That's not only patients, but providers. A lot of physicians aren't familiar with lipoprotein A. And secondly, because we don't have direct treatments today, that raises some barriers. But I think people misunderstand there's a lot we can do, even if we don't have direct treatments. Those are some of the barriers, but I think they're going to change.
Absolutely. And Dr. Khera, in your opinion, why is it crucial for healthcare providers to include LPA screening as a part of routine health assessments? I know you mentioned earlier that some doctors may hold off from doing that. So can you explain the significance in that?
Well, first is it's such an easy test. I mean, it's a blood test. People get annual physicals. Just throw it onto that panel. Really easy to do. Nothing fancy there. I think the barrier, again, is just knowledge and understanding of it. I think as people get more comfort, like many things that we've had over the decades in medicine, as people understand it more and have more comfort, I think those barriers will come down. But patients need to advocate for themselves, and that's what we'll hear about today, is helping people understand about lipoprotein A.
Absolutely. And as we wrap up today, can you tell us, for those who are watching who want to take proactive steps to safeguard their heart health, what actionable advice or resources would you recommend they seek out?
Great question. So first, obviously, all risk factors are important. Know your numbers, your blood pressure, your cholesterol. Lead a heart-healthy lifestyle. There's plenty of websites. As it relates to lipoprotein A, we encourage people to get information. Again, findlpa.org, the Family Heart Foundation website, can give you a lot of information about lipoprotein A.
I want to thank you both so much today for sitting with us and talking about this pressing issue. It really is an important topic, so thank you for sharing more.
Thank you for having us.
Yeah.
For more information, you can visit their website at familyheart.org and findlpa.org.